Good morning, precious Ida. This is unbelievably exciting because you and I have worked together for probably almost coming up 5 years.
Yeah.
And so this has been one of the dreams that we set out 5 years ago, and we are now we're going live with this podcast. So the first interview is with you. And I want to introduce you first, and then I'm going to ask you to tell us a little bit about yourself.
Okay.
And then you've got a question for me, which I'm going to do my best to answer. But as far as I'm concerned, and I'd like anyone that watches this first episode, I'd love them to know this. It has been a remarkable honor to get to know you and work with you for two reasons. One is that you're an absolutely unbelievable human being with the biggest heart in the world. You're definitely an old soul because you've got wisdom that is thousands of years old, even though you're young and beautiful. And then the second thing is that you have managed to work with unbelievable consistency, integrity, wisdom, and intelligence when you, as the people that are listening to this will come to know, you are also, like me, living with an absolutely, if I may say so, catastrophically challenging but precious body. So I'm going to leave it at that. And Ida, would you like to just tell us a little bit about yourself?
Yes. My name is Ida. I have a condition called Ehlers-Danlos syndrome, or EDS. And Catherine suffers from the same condition as well. It's genetic. I've received it lovingly from my mother. And I've lived with it since I was born. I live with chronic pain on a daily basis. I struggle quite a bit with it, and I have over the years sort of found it difficult to find a way of managing day-to-day life, as many other people with chronic illness, to be able to just do the day-to-day basics to function really. And at the age of 26 roughly, I couldn't do employment anymore. I ended up, I had two options in my head. I either just filed for sick pay and lived on that, or I figured out a way of doing it on my own. So what I did was I actually set up my own business to be able to operate my working hours around my condition. And I'm so incredibly glad that I did, because it meant that a couple of years down the line from doing so, I ended up meeting Catherine, and who was setting up her business then. So I was fortunate enough to be part of that. And along that journey, I've learned so incredibly much, but I'm still continuing learning about it. And I didn't really realize how much what you teach plays into every part of life, both physical, emotional, spiritual. And so it's been an incredible honor to be part of it.
Thank you, Ida. Okay, so you've got a question that's related to that, which I think many people through the years have asked me. So it's a brilliant question. And I want everyone to know that most of the time I don't have warning of what the questions are. So this is an adventure for me. But on this occasion, I do know this question. So go ahead and ask it, and we'll see what the answer is.
I'd like to know the difference between integrated medicine that you teach versus normal medicine, as people would call it, or Western medicine. Because even though I've worked with you for an incredible amount of time, I understand the concept now of it, but it would be interesting to hear your opinion on how you'd explain it to somebody who hasn't heard it before.
Okay, so this is making a very complex I guess paradigm, quite simple. So Western medicine as it is practiced now is basically a medicine where you go along to a doctor or a consultant and you give them your signs and symptoms. And according to your signs and symptoms, you will be possibly offered medication, surgery, radiation, chemotherapy. Increasingly now, which is fantastic, you might be offered physiotherapy or some counseling therapy. So I was qualified many years ago. And what is lovely is that Western medicine is beginning to incorporate more choices for clients and patients.
Yeah.
So Western medicine is very orientated still according to your signs and symptoms.
Yeah.
Integrated medicine, or integrated Chinese medicine in particular, which is over 7,000 years old, is entirely based on getting to the roots of what your own feedback mechanism in a mind, body, and spirit way. So not spirit religiously, but your own essence, your own spirit living within this body.
Yeah.
What it's saying. So you would come along and give me signs and symptoms. You might even tell me that you don't feel as if you have any physical symptoms, but you're registering that you're enraged the whole time, or you're always irritable, or you're overwhelmed, or you're always sad, or you just cannot let go of your last lover, or when people get to know me, they come to me about all sorts of life's issues on a literally on a mind level, on a body level, on a physical, spiritual level. At the moment, I'm even working with a house and all the people involved in this house. So my work as an integrated practitioner is very different. So I have business people ringing me up and saying, I've got this symptom in the business, what do I do about it? And I will get to the roots. And what we mean by the roots is why and how is the body, what's going on? So I'll leave this question with just one example. So when people come to me who know that they're not managing their impatience or anger, let's say, and they feel safe enough to tell me that they're becoming really rageful and they're just furious with everybody, then I can find out immediately what's going on, for instance, with the liver and the gallbladder. So I call the liver and the gallbladder, I give the analogy of it being like a Hoover bag. So if you clean up the liver and the gallbladder, then usually and fairly quickly your irritation levels can begin to go down.
Yeah.
But it's up to me to find out exactly what's going on. And then with you, we unravel the puzzle. So the company that you and I have been building is Unravel Disease Naturally. The next one is going to be Unraveling Your Potential. So my job, and now your job, is to help people unravel the next layer of life. So alternative medicine is very much about giving people back ownership and a greater sense of responsibility for their own lives, and in a way that's fun and light. And is an adventure, and you never get to the end of this adventure getting to know yourself. So does that answer that question?
It does, and it's fun because I mean I've experienced that myself working with you as well. I thought, you know, my approach to doctors and going into healthcare in general has always been, oh, it's another one of these, and it's another appointment that's going to take 6 months. It just feels like work. But when you don't, when you get that ownership, when you get to that ownership of your own well-being, and actually can see how easy it can be, and how, you know, just little things that you can do throughout your days that feels like the tiniest little like shifts, and you can still create a completely different lifestyle. Like my lifestyle now comparing to when I met you is totally different. Like I was on ridiculous amounts of cocodamol and opioids and God knows what, and you know, I've been able to, not only have I been able to take control and do things more naturally with you, but I have also been able to the extent that I have been able to, to the extent that I've needed to rope doctors in to do certain things, I've been able to do that in a different way without it driving me absolutely insane.
Yeah.
So
And
it's yeah.
Sorry, Ida, I mean, I think what's fun is when you can begin to utilize the skills that Western practitioners have, but participate more, so that the burden isn't so much on this darling human being who's working in a system that is very overloaded at the moment.
Exactly.
So
and it's fascinating to watch. I mean, we have a membership as well that we have quite a few people on there who lives with different kind of chronic illness, and it's just been amazing to see them kind of go through the same journey, you know, being able to, picking them up when they are at their lowest and giving them a community to kind of go to, and the advice, you know, from 1 year to year number 3 that they've been with us, for instance, and see the changes. It's incredible. Yeah, it's been amazing, and I'm really excited.
I think that's what's really motivated me, because I mean, you've mentioned the hair loss, and it's rather typical of me that I have, for listeners, hair loss is a big subject, and there are various different types of hair loss, and we have a couple of members like Ida who have one type of hair loss, and then I have another type. But the point is that, as in the membership, and with individual people that I work with, the ones who have chronic illness, you know, Ida's emphasized that you can make tiny little shifts that makes such a big difference. And when people pay me the compliment, and I think Ida the compliment of going, you know, how on earth do you do it? Why do you look so well? We have the fun of being the wellest that we can possibly be in an integrated way, when in fact, when the consultants see our scan results and our blood work or whatever it is, they're mortified at how compromised our bodies are. So, you know, we're building something that allows people who are sick and tired of being sick and tired. It allows them to know what they can do for themselves. And they may spend the rest of their lives with Western medicine and needing Western medicine, which we have huge respect for. But it doesn't mean to say that the quality of thriving actually goes down the tubes. So
exactly.
That's so it's really exciting. I really wish, Ida, that you didn't have this on some levels, but I think on another level, like me, you consider it to be a huge privilege, because you cannot take yourself for granted, you cannot be complacent, and therefore the quality of your life and your willingness to go to any lengths is absolutely there the whole time. So,
and I also think that people who live with this sort of thing, you know, any kind of chronic illness, has a complete different understanding of others and a level of empathy that you know, doesn't always come across in some people. So I think it's a massive privilege in that sense to have it.
and I think the world needs it.
Definitely.
Thank you so much, Ida. And
Thank you.
we're going to end this interview, and then I know that you're going to be on the second recording, and then you've got another question which I don't know, so that'll be a great surprise. Take care. Bye, Ida.
Thank you so much. Bye-bye.